Are women who receive radiation therapy to the left breast at a greater risk of developing heart disease? Potentially. Since your heart is more to the left side of your chest, there's a good chance that it will receive some dose of radiation, which can increase your chances of developing heart disease later on in life. You see, this is what we call a late side effect from radiation, which can occur several years, even 20 to 30 years after you finish treatment. Studies have shown that in women who receive radiation to the left breast, about 10% of them end up developing heart disease over the following 20 to 30 years. Now, 10% may not sound like a lot, but it's double the rate amongst women who've had radiation to the right breast. Regardless, it's still extremely important to go ahead with radiation therapy if that's what's recommended to you by your oncologist, because it will potentially save your life by getting rid of cancer cells, which is way more important than the potential risk of developing heart disease later on. Even if you've already had surgery and your surgeon told you that they were able to remove all of the cancer cells, they will still often recommend that you have radiation therapy after surgery to kill any residual cancer cells that may have been missed at a microscopic level. Also, technology is improving all the time, and now there are several different treatment techniques that will reduce the amount of radiation that your heart receives. Here are a few of the most common ones. Number one is what we call prone treatment. This is where you're lying on your stomach on a special board that allows for your left breast to hang into a hole. This distances your breast away from your chest and makes it a lot easier to treat it while delivering less radiation to your lungs and heart. Technique number two is called the breath hold technique. This involves you holding your breath while the radiation is being delivered, usually for around 15 to 20 seconds at a time. Sounds like a long time to be holding your breath, but most people surprise themselves and they're able to do it just fine. So the idea is when you take a deep breath in, your chest barrels out away from your heart. And this means that your heart will receive significantly less radiation while the treatment is being delivered. Technique number three. Before you start your radiation treatments, you'll have a special CT scan that will be used to plan your treatment. When creating this plan, your team of radiation therapists can shape the radiation beam according to your personal anatomy and avoid dose to your heart that way. So if you're going to have radiation therapy to the left breast or chest wall if you've had a mastectomy, ask your doctor what they intend to do to protect your heart from the treatment. The bottom line is that it's really important to go ahead with the radiation treatment if it's recommended to you, because if you don't, your risk that your cancer will come back someday will be greater, much greater, than your risk of developing heart disease later on. If you found this helpful, please let me know in the comments below, and I'll see you in the next video.